Hi, I'm Alexander. I'm one of the emergency specialists in Newcastle. And I attended a bargaining meeting on Monday, the 16th of December. It's the first time going to one of these. I wanted to tell you all about it. It is a glacial, frustrating, and antagonistic experience. The whole thing, the meeting itself goes for 5.5 to 6 hours, and it is quite impressive how little you can achieve in that time. Government is there. They clearly don't want to be there because they've got nothing to offer. They've been given instructions that we have 10.5% over 3 years. That's it. There is no money. Stop asking us. So it's all quite insulting. But yeah, look, what did we talk about on Monday? What did we talk about? There was two things that were... There was a bit of daylight, there was some wins. So the first one is very simple, union rights in the award. So you can have union activity in the workplace that's protected. If you go to union meetings or actions or things, that can be a sort of a leave type. You can get a day off and go do that, which is a very standard thing in most awards, especially in health. Wasn't in ours. Hopefully will be. The other one is this idea of permanence in health contracts. So at the moment, sort of junior doctors especially, the standard contract type is temporary. You get a year, you might get 4 perhaps if you're on a training program to get through to fellowship, but not always. And you're constantly just re-interviewing. So ASMOF's proposal is we change the standard type to like a permanent contract. You get a job in New South Wales Health and you've got a job somewhere in New South Wales Health ongoing. Of course, you reapply for training positions and like several other positions and, to move to a different hospital or whatever it is. But New South Wales Health will always give you some form of employment. There's a lot of details to work out here, but we're both in agreement it benefits both parties. So you're a doctor, you get a job forever, you can apply for a house, you can keep your leave, you can do family planning and things and not take leave and then just not have a job anymore. The government gets to have a stable workforce. They know what's happening in the future, hopefully cut down on locum costs. So there's some common ground there. Now, the thing with both these positions is it costs nothing. There may be some like cost-saving benefit to government there, which is fine, but anything with a whiff of $1 attached was an absolute non-starter. So we briefly discussed again today the concept of a pay rise, and again, that's a no. Any cost increase, any pay increase has got to be offset by a productivity gain, which is absurd when you look at the increase in workload over the last 5, 10, 15 years without a commensurate increase in pay or even staffing in a lot of cases. The idea that we've got to work harder or do more of what we're already doing before there's any kind of pay increase that's vaguely in line with the rest of the country is insulting. But that came up again. We did talk a lot about work safety and safe hours in particular. So ASMOF's proposal is along the lines of, the details of the policy and the clauses will be negotiated, discussed, but we are proposing a few things in terms of safe hours across the board for junior, senior doctors. So 1, 10 hours between shifts, work days, on-call periods. And a day on call is almost universally a day worked. There are a few services now that have an on-call period where they don't get called, let alone called in. So 10 hours break, it's what is in the nursing award, it's standard, it's safe. No more than 10 shifts in a fortnight. When you have days off, they've got to be contiguous, so they can't just give you a Tuesday and a Saturday or something. They've got to be 2 in a row. And then when it comes to nights, ASMOF is proposing a maximum of 7 night shifts in a row. This has been been several polls over the years, and ASMOF membership has consistently said sort of prefer a maximum of 7 as a cap. And then after you have your run of nights, you've got to have the same number of days off as you had nights worked. So this is all pretty safe practice, is kind of standard, reasonably evidence-based and based on what the membership wants. And then acknowledging that this isn't always possible due to the nature of the work. Sometimes it's going to be rostered, sometimes it's going to be unrostered, sort of callback and staying back. And that's fine. And in those events of that happening, and the service has to go on because we have to care for our patients, and we're not just going to stay home and sleep and let our patients suffer. If that can't be planned for, you should be compensated for the unsafe work that you're doing. There's some sort of danger money associated with it on top of usual overtime sort of pay. So, pretty basic safe work stuff, and it's a no-go because there's money attached to it. Potential money, it's a penalty. The government doesn't have to pay it if they want to roster us safely, but they know they can't because they don't have the staff, because they're not paying doctors in New South Wales and no one wants to work here. Their concept is safe rostering practices exist in policy as they are, and there's mechanisms to address that. I mean, firstly, the policies are profoundly vague, and they're not enforced. The current mechanisms that exist now and just frankly isn't working, and what they're proposing continues is if people are rostered against rostering guidelines, you can go to the union or take yourself to these various LHD level meetings with executive and complain. So what they're saying is if you did a run of shifts in December that was unsafe, you did like 13, 14 days in a row, you wait until March, sit down at a committee meeting with the chief executive and say, they're not following safe practices 3 months ago. And that's it. There's no penalty. It keeps happening. It's going to happen again. There's no recourse. Like, you still did the unsafe thing. You suffered. Your patients potentially suffered. So it's grossly inadequate, and it's quite insulting. So yeah, again, a non-starter. So look, where to now? There's a few more meetings scheduled in sort of early kind of mid-January period. We talked about meeting planning and said, when's everyone available? Look, everyone on the ASMOF side is clinical, and we're just working over Christmas and New Year's. That's what we do. Government they get a break, a few weeks off, so we'll come back in January. And we'll get through some more lawyer claims. So we're still in bargaining, but that's sort of running out through January. That's when things are scheduled. So what can you do? So get involved. Obviously, sign on to ASMOF if you have not already. It's worth it for the industrial protections. It's worth it for the travel insurance, and it's worth it to support this award campaign. It's vitally important we fix this to ensure the future of our careers and the future of public health in New South Wales. Get involved in your workplace. Contact the ASMOF campaign email if you're interested in getting involved and organising locally. There are more and more people doing organising on the ground everywhere across the state. You may have come across them. Contact those people as well, and start organising your workplace. Talk to each other, support each other. We'll see you in the new year.